Hi guys, welcome back to the channel. I'm Dr. Downey, and today we're going to discuss acne scarring and the treatment of acne scarring. This is a follow-up video to the previous video I made on acne and how to treat just acne. So acne scarring is an important topic because early and effective treatment is most important, since if you leave it too long, it's not going to be as easy to correct. The issue is no therapy has been demonstrated to remove scars completely. Most therapies just reduce the appearance and prominence of scars, so make them less deep and less noticeable, essentially. And treatment kind of depends on many different factors, whether or not you have these treatment modalities available, whether or not you want to deal with the certain side effects of the treatment, just your preference and the cost. And obviously not all these treatments are available everywhere. The problem is that as of yet there aren't really any alternative treatments. Most of it is medical at the moment. And alternative treatments haven't been shown to be efficacious, and medical treatments, although they do have a few studies behind them, none of them are gold standard as of yet. They are kind of not 100% effective as of yet. But to treat scarring, we also need to prevent it first from happening, and the problem with preventing it is that we don't know why it occurs. Some individuals are prone to scarring, whereas others are not. Although there is a relationship between the degree of acne and scarring, some individuals with the same degree of acne or cystic acne will not both have the same level of scarring, and that's just individual factors. Essentially, scarring is when there's an imbalance between collagen synthesis and matrix degradation in the actual wound itself. And we aren't sure why it occurs. Some people say, oh, it's because you pop them or something like that and that you leave a scab. Whilst that could be true, it hasn't been proven as of yet. Furthermore, we have different types of scars that will determine the treatment. So you have atrophic scars, which are the most common type, or hypertrophic. Hypertrophic means it's just you have a scar and it kind of grows out and it becomes very big and noticeable. Atrophic is like where it looks like you're missing skin. Those are the most common types. So not everyone should seek treatment for scarring. Well, everyone should take precautions, especially if you have ongoing acne. It's best to treat that first. And individuals with darker skin tones should be aware that hyperpigmentation, where darkening of the scar, can occur with the use of these procedures that I'm going to mention. And if you've used Accutane or isotretinoin recently, it's best to avoid the traditional laser ablative surgery treatment. However, most other treatments actually aren't contraindicated in these circumstances. They prove that. It's just the traditional ablative laser resurfacing. They used to say that needling and things should be postponed also. However, that in a systematic review, they proved that was not necessary. Again, as I mentioned in the beginning, there's a lot of information lacking and studies lacking, especially high-quality trials on the treatment of acne scars. And there is no first-line treatment, but it has been suggested that there are 3 general steps to treating acne scars, which I'll go over. Another issue is that non-facial scars are more resistant to treatment, so scars that are on your shoulder or on your back seem to not respond as well to these treatments I'm going to mention, but we'll just mention them anyway. So again, there are 3 general steps. Usually the first step revolves around reducing the appearance of very prominent scarring and reducing the redness of scarring, or the erythema. So to remove that erythema or redness, which will make the scar less noticeable, usually this therapy called pulsed dye laser is used, and so far this is the best for any type of erythema or redness. However, there are other treatment modalities such as potassium titanal phosphate lasers and things like that. However, pulse dyed laser is the best for that. Again, the first step is also removing those challenging scars, those deep scars, and for those scars it will depend, the dermatologist will decide, but it may need subcision or punch excision where they cut the scar out, and but that all depends on how severe the scar is, and not all of them will need that. So once all the above is sorted, you move on to the next step, which is collagen remodeling. So collagen remodeling is more important for those atrophic scars that I mentioned, the ones that are kind of look like they're a dent in the skin. And the first line at this point is traditional ablative laser resurfacing, or which again you shouldn't use if you're on Accutane. However, non-ablative fractional laser resurfacing has been proposed also. However, you may need more treatments, whereas the traditional ablative one, where it's very rough and there are more side effects. However, with the traditional ablatives, you tend to only need one session, whereas non-ablative, you may need multiple sessions. Other treatments, if you do not choose the above, include chemical peels, and these can be effective treatments. So you have different types of chemical peels depending on how deep in the skin you want to go. You have your epidermis and your dermis beneath. So you have superficial chemical peels which don't penetrate so deeply. So these are better for more shallow scars. And in this you would use things such as salicylic acid, glycolic acid, lactic acid, trichloroacetic acid, 10 to 25%, and this will only really affect the epidermis and is better for shallow scars, as I said. And then you have other treatments such as deep phenol peels, which actually go to the dermis of your skin, and these tend to be a bit better for deeper scars. But in a randomized control trial where they did a superficial chemical peel with skin needling, the effects of that were actually similar to a deep chemical peel. So perhaps you won't actually need a deep chemical peel. You could use a superficial one with needling. Again, there's derma abrasion for acne scars. However, since the introduction of ablative laser treatment, which is quite harsh, so is derma abrasion, but since the introduction of that, laser resurfacing or ablative treatment is preferred to derma abrasion. But if your dermatologist or treating individual or beautician is quite good at derma abrasion, it can be very highly effective for severe scarring. And as we noted above, skin needling can be used, which essentially kind of just damages the skin slightly. It introduces like these spikes into the skin, and it goes all the way down to your dermis, and this can help with the healing process in collagen remodeling. So the last step is not everyone needs this last step, but it's essentially additional therapy or adjunctive treatment. So you take the first two steps, and if you're not satisfied with the above results, you go on to the third step. So adjunctive therapy should be halted for a bit because it takes about 6 months or so for collagen remodeling to be noticed. But essentially this would consist of things like fillers for the skins. It's actually so skin fillers are actually quite good for those deeper scars which are not being treated, and that seems to be one of the best and only adjunctive therapies. You can have a non-ablative treatment if you had the ablative and it didn't work so well, and then you do that in 4 to 8 weeks intervals, but injection of the deeper scars which aren't being treated seems to be the best. So I hope that helped you understand how to treat your acne scarring, and if it is bad, I would definitely see a dermatologist, as they would perhaps know the most about how to treat acne scarring, as no other alternative treatments have really shown to be efficacious as of yet. So thank you for watching, and I'll see you in the next video.